From his first day at the Food and Drug Administration, Dr. Peter Marks evaluated and researched vaccinations, saving countless of lives. He played a key role in Operation Warp Speed to bring Americans COVID vaccines and treatments. Now he's gone, a departure that sent shockwaves through the medical community. He says HHS Secretary Robert F. Kennedy Jr. didn't require truth and transparency, but instead wanted confirmation of his longstanding skepticism of vaccines. That is, until yesterday. In his strongest endorsement yet, RFK Jr. says that the MMR vaccine, which helps protect against measles, mumps, and rubella, is the most effective way to prevent the spread of measles. The secretary said that he said this actually while visiting two families in Texas whose children have died from the virus. Those deaths, part of a massive outbreak in West Texas, which has seen nearly 500 cases now. The CDC is deploying a second response team to the area. Oncologist, hematologist, and former director of the Center for Biologics Evaluation and Research at the FDA, Dr. Peter Marks, joining me now. Doctor, as you cited in your op-ed, Kennedy's misinformation on vaccines was the reason that you left. So why do you think he's encouraging the use of the vaccine now?
Thanks so much for having me today. So I think he's doing this. I'm not going to really speak to a lot to Mr. Kennedy because I'm more interested in getting children protected against measles. But I would urge people to look at his statements, which seem to be on both sides of the coin. He did not have a full-throated endorsement. You should get your child vaccinated. We need vaccination now in communities. And I think I'd love to see that the CDC goes out there and touts vaccination as that is the way you prevent measles. That's the way you prevent children from dying from measles. Vaccination is how we will get this under control. Vaccination is how we could have protected our children so that we would not have had the first two childhood deaths of measles in the United States in the 21st century. That's right. These two deaths are the first two children to die of measles in 2025. And that says something very significant. So we need to have a full-out, full-bore campaign about trying to get measles under control here. Because if we don't get measles under control, and the state of Texas is concerned about this, their state health department has noticed this. If we don't get this under control by the end of this year, we will lose measles elimination status, and that will be very significant. But what's much worse, because measles reproducibly kills about 1 in 1,000 children who it affects, we will lose more child's lives.
And, you've just pointed out what makes measles so dangerous, but I think we should also point out why vaccines are so effective.
Yeah, so I really appreciate that question. So let's just remember that the measles vaccine is one of the vaccines that has one of the most favorable benefit-risk profiles. We can sit here and argue about flu vaccines, COVID vaccines, other vaccines, but the childhood vaccines have been incredibly well studied. And the measles vaccine, which is credited with saving 50 million lives over 50 years, is remarkably safe and remarkably effective. In terms of safety, it's true that in about 100,000 children vaccinated, about 15 to 20 will have a medically attended event. Those are all transient events. Many of them are actually preventable by monitoring your child's temperature and keeping it from getting above 101 degrees after they get the vaccine, because about a week after, many kids get fevers. But measles vaccine does not cause death. It does not cause encephalitis, a swelling of an infection of the brain, and it does not cause autism. On the other hand, measles kills per 100,000, 100 to 120 children. And that's simply just a very simple calculus. Either you have a vaccine that can save the lives of 100 to 120 children, or not vaccinate your child and lose our children and lose that opportunity. So it's a very simple calculus to me. We need to get over this issue of having needless deaths, senseless deaths, by encouraging parents to get their children vaccinated. And I would just ask parents, I know we want to do the best by our children. If you have concerns, you ask your doctor. If you have concerns about your religious beliefs and vaccination, ask your clergy member. But we need to have these concerns answered because we must get measles vaccination rates up so that we protect those who we love, our children.
I have to, as I'm listening to you, and I understand you were feeling pressure and you didn't believe in the misinformation that was being put out there, and you definitely were not agreeing with how the HHS secretary was dealing with things. But as we talk about the CDC dealing with this outbreak, as the department just lost 1/5 of its workforce, the agency is, is it going to be prepared for future outbreaks? And then a voice like yours that was so important to be in the mix, why resign? And are you concerned about the future of the agency now?
Let me make no mistake about it. I did not leave on my own terms, okay? So you can take that and interpret it as you like.
Didn't
I do
resign.
worry. I resigned. I said I didn't resign on my own terms. Okay.
Okay, I gotcha.
Sometimes I think there's already been reported in the press that that I was given an alternative. But let's leave that, because what's so important here is that we as a country, I don't care about me. I'm going to land. I'll be okay. Okay. I'm going to be okay. But I'm not sure that our children of this country are going to be okay, because just as sure as this thing continues to spread, the number of cases that have been reported to date, about a little over 600, probably only represent about 1/5 of the actual number of children infected. And that's why we've seen our children and adults affected. That's why we've seen about 3 deaths overall. And if this continues to spread, we're simply going to have a situation where more children will die. And the only way, things like budesonide, clarithromycin, vitamin A, those are not preventatives or actually even real treatments for measles infection. What is preventing it by getting our children vaccinated with one of the vaccines that is incredibly effective, 100% practically effective against death, 98% effective against preventing measles, with no deaths from the vaccine. It should be an easy decision, as easy as buying a car seat and strapping your kid in. You would never drive without your kid strapped into their car seat. If you had an 18-month-old, why wouldn't you give that child something that could prevent your child from dying of an infection when there's a 1 in 1,000 chance if they get measles, they would die from it?
Well, it's a shame that you would be forced out of position like this when you have the background and clearly the transparency of what needs to be done in a time like this. And we don't want to see any other kids die. And it's hard to report the new cases as they come forward. But it's always great to talk to you, Dr. Peter Marks. Hope that you'll come back as we continue to follow this story. We will not lose sight of it.